Hello everyone, I'm Loa and today we will be talking about the coronavirus. So objectives include: first, symptoms and causes of COVID-19. Second, roles of imaging in COVID cases, and also we'll be mentioning the use of CT scans and X-rays in COVID-19. We will be talking about MERS and SARS, and lastly we'll be talking about the different phases of COVID-19. December 2019, specifically in Wuhan, China, a novel coronavirus now named as SARS-CoV-2 caused a series of acute atypical respiratory diseases. The disease caused by this virus was termed as COVID-19. The virus is transmittable between humans and has caused a pandemic worldwide. The number of deaths tolls continue to rise, and a large number of countries have been forced to do social distancing and lockdown. Lack of targeted therapy continues to be a problem. Epidemiological studies showed that elder patients were more susceptible to severe disease, while children tend to have milder symptoms. The three main symptoms of COVID-19 include shortness of breath and chest pain, second, high fever, which is usually higher than 37 degrees, and lastly, dry coughing. Before getting into the symptoms, similarities, and differences between COVID-19, MERS, and SARS, first, what are MERS and SARS? So MERS, which is also can be called Middle East Respiratory Syndrome, is a species of coronavirus which infects human bats and camels. The infecting virus is an enveloped positive sense single-stranded RNA virus which enters its host cell by binding to the DPP4 receptor. Moving on to SARS, which is an infectious disease with symptoms including fever and cough, and in some cases progressing to pneumonia and respiratory failure. It is caused by a coronavirus. This picture clearly shows how MERS and SARS look like in real life. However, it's also showing Ebola and HIV, and it's not what we have to care about for now, but you can have a look at the SARS and MERS and how they look like. So, since coronavirus is getting really common nowadays in our world, a lot of people are getting terrified and they don't know the differences between common cold and COVID-19, and this can cause them to a lot of confusion. So, this table clearly shows the differences. First is fever. It sometimes occurs in common cold, and if it happens, it's higher than 38.5 degrees Celsius. However, in COVID-19, you have really high fever. For cough, sometimes you have cough in common cold, however, you have really dry cough in COVID-19. And for runny nose, it occurs in common cold, however, sometimes you can have it in COVID-19, and same is applied for sneezing. For headache, both diseases have headache and actually really bad headache. And for malaria, there is malaria in COVID-19, however, you don't have malaria in common cold. And for loss of smell, sometimes patients lose smell and sometimes they don't. And for conjunctivitis, sometimes it occurs in common cold and that depends on the virus. However, for coronavirus, yes, you have conjunctivitis. And then for skin rash, you don't have skin rash in any of them. And for fatigue, sometimes you have it in common cold, however, you have really bad head fatigue in COVID-19. And now I'm going to be talking about the COVID-19 in a radiographic point of view. The similarities and differences regarding symptoms of SARS, MERS, and COVID-19 include that they all have fever or chill, dysphonia, malaise and malaria, and also headache. However, for cough, for SARS and COVID-19, it's dry, but for MERS, it can be dry or productive. Then for diarrhea, it's common in SARS and MERS, however, it's not common in COVID-19, and same is applied for vomiting. For sore throat, it is common only in SARS, it's not common in either MERS or COVID-19. And also same is applied for arthralgia. It's only common in SARS and it's not common in both COVID-19 and MERS. Imaging. So, although the diagnosis of COVID-19 is suspected on the basis of symptoms of pneumonia, which include dry cough, fatigue, malaria, and fever, as well as history of recent travel to China, exposure to a known patient, chest imaging plays a really important role in both assessment of disease extent and following up. Also, chest radiography typically shows patchy or diffuse asymmetric airspace opicities, which are similar to other causes of coronavirus pneumonias. The first report of patient with COVID-19 described bilateral lung involvement on initial chest CT in 40 of 41 patients, with consolidative pattern seen in patients in the ICU and predominantly ground glass pattern in patients who were not in the ICU. Also, an investigation of an initial chest CT findings in 21 individuals with confirmed COVID-19 reported abnormal findings in 86% of patients, with majority of 16 out of 18 having bilateral lung involvement. Multifocal ground glass opicities and consolidation were reported in 57% and 29% respectively, with peripheral lung predilection. Likewise, the chest imaging in a family cluster of 7 people with confirmed COVID-19 showed bilateral patchy ground glass opicities with greater involvement of the lung in the older family members. Although the imaging features closely resemble of MERS and SARS, involvement of both lung on individual imaging more likely to be seen in COVID-19, initial chest imaging abnormalities in SARS and MERS are more frequently unilateral. So these are clear examples of CT scans of people that have been diagnosed of having COVID-19. So the first two at the top are for a 79-year-old woman who presented with fever, dry cough, and chest pain for 3 days, and they found out later on that her husband and her daughter-in-law they had COVID-19. So as you can see, the one at the top left is an axial, and the one at the top right is an coronal. And the CT images, they show multiple of patchy peripheral bilateral areas of ground glass opacity. For the second two images, which are at the bottom, they are for a 47-year-old Chinese man with 2 days history of fever, chill, and productive cough, sneezing, and fatigue, who presented to the emergency department. And the initial CT scan obtained show small round areas of mixed ground glass, opacity, and consolidation. And the image at the bottom left is a ventricle, and at the bottom right is in right and left lower lobe posterior zones. And now following up CT images obtained 2 days later, and they show progression of abnormalities at level of aortic arc. And the image at the left presents the ventricles, and the one at the right, which now involves right upper and right left lower lobe posterior zones. And here is 2 images, and the first image presented a normal lung, and the second image that's split into 2 parts represents an X-ray. The first part is an X-ray of an infected lung, and the second part is a CT scan of the infected lung. So in the incubation stage, the coronavirus is going to continue on multiplying in the host. Then week 1, you're going to have symptoms like fever, shortness of breath, abdominal pain, and chill. And for week 2, you're going to have pneumonia or ARDS or acute respiratory syndrome. Then week 3, there will be an absolute organ failure and sepsis. Now, to sum everything up, in this video I talked about COVID-19 and how it started to spread all around the world. I also said that a lot of elderly are getting affected more than kids, and this is because of them having a lower immune system. I also mentioned MERS and SARS and their differences and similarities, and also I compared them to COVID-19. I also mentioned the stages of symptoms of the COVID-19 week by week and how they develop. I talked about the x-rays and CT scans, and I showed a normal lung and compared it to a CT scan and an x-ray, and I even showed infected lungs, and I talked about the x-ray or the CT scan, and I explained it in details and how the lung is infected.